Before we begin this week's edition of NHIS in a Week, the staff of the NHIS Bono Regional Office welcomed the Chief Executive, Dr. Bernard Okoboy, to a rousing rendition of an a cappella to express their appreciation of his good works as the CEO of the NHIS. Enjoy.
We welcome you to Sunyai, the capital of Bono, formerly known as Afro. A beautiful city with a calm environment. Dr. Okoboy, Bono, my name, our Pabo, Udisi, Shewe Jumase, Yesre Yamishira Maho. The 5D initiative, we pray for successful implementation. Dr. Ebonoma Kemawakwaba Udinsiya Shewedumasi Yese Yamishira Mao Kolano the 5D initiative, we pray for successful implementation. Dr. Ebonoma Dr. Siadioye, Dr. Ebonoma free uniform for staff, procurement of vehicles, the 5D initiative. We call you the show boy, Dr.
Hello and welcome to this week's edition of NHIS in the Week. My name is Angela Asiri. Now to the headlines. Dr. Okoboy tours Bono East and Ahafo regions. Sunyani Municipal and German South receive new vehicles. NHIS CEO pays homage to Doma Hene. Now to the details. The Chief Executive of NHIA, Dr. Okoboy, and the team from the National Health Insurance Authority embarked on a 4-day working visit to the Bono East and Ahafo regions as part of his nationwide tour. He began his working visit by interacting with staff of the Bono Regional NHIS office and the Regional Coordinating Council. The CEO lauded the work done by the Regional Office and the Regional Coordinating Council for their continuous support for the National Health Insurance Scheme.
We are very happy to be here. I would like to start by thanking the Regional Director and his team for the organization. Let me also thank all staff at the Regional Office. Let me thank district staff who are here for all the good work. You know, when the director was speaking, he mentioned that your target, you hit about 99.6%. And in school, when you get 99.6, it means you scored excellent. That is A+. So a good round of applause for all. I remember when I arrived, the director came to me and told me, Doc, I sent you some issues some months or weeks ago. There are issues bordering on operations in the Bono region. And I told him, Director, I get plenty issues on my table. But the reason why we visit like we have done is to make sure that we come face to face with the issues so that they don't look like issues on paper. You know, when they write the issues on paper, it's like a story or a script. But when you come and experience it, then you are fired to make sure that you work on them. So my prayer is that I come across more issues whilst here.
With about 95% of residents in the region enrolled on the NHIS, Dr. Okoboy reiterated that more work must be done to ensure the remaining 5% are captured on the NHIS for seamless access to healthcare. He made this statement when he visited the Bono Regional Minister, Honorable Justin Awusu-Banahene in Sunyani on the first day of his tour of the Bono East and Ahafo regions.
Ghana is not only Accra. Ghana goes beyond the corridors of Accra. And so if you have CEOs, ministers, and other people, stakeholders who are in charge of affairs, who will move away from Accra and come down to see things for themselves, I think we applaud that. And so we give you that applaud this morning, having come to build that and see things for yourself.
The Chief Executive, Dr. Okoboy, presented 2 new NHIS branded vehicles to the Sunyani Municipal and the German South District offices during his visit to the Bono region. The vehicles are to aid in the day-to-day activities and the operations of the districts as they work towards the increase in membership enrollments to achieve universal health coverage by 2030. As customs demands, the CEO, Dr. Okoboy, and his entourage paid a courtesy call on the Doma chief, Osajifo Oseadeyo Ajimambedu II. The visit was to officially announce the commissioning of 2 new NHIS district offices, a presentation of 2 new vehicles to some district offices, and to court support of the Bono Traditional Council in promoting and sustaining the NHIS. Dr. Okoboy, during his visit, reaffirmed his management's commitment to strengthening the scheme and admonished the Domahene to rally behind the NHIS to get all his subjects medically insured.
Osajifo abwaye na obia oye bunu ba owo region ha any beyond omo de omo ho bejimu aisho so omo insurance card me pese me fa me announce wo ha say every month bosumi bia abai efa national health insurance so Emma hospitals ewo Ghana ha nyina about 150 million Ghana cedis every month ayesika yedi mawo say Oma Ghana for Oma Pomudi in time Amoko hospital. Now, Osajifo, despite Skawe Etiano, Oma ultimately say Obiko hospital, Okodru Hono, Sebi Jessica, Efrin. And Sa Subano, sometimes my ma, you know, people pay sell my insurance. Now, me ba say, my ma Osajifo assurance, say, yeah, Jumadin. I sure say omo yes niye no omo de saa suban no omejai ama Ghana ni hospital a yebetimi ahwe wo ampa sebi enye yare bia wo wiase na health insurance e cover nanso 95% of yare bebre a robo beka say common diseases e say typhoid malaria oba ekọ awo so be operation fibroid yare yi awode ni nyina insurance cover. Eti mi ba anopa ise mesre nana ade ba kwa ye ho ni se utu anamo na ahemfo tawechia anamo no ebesi.
The Domahene Osajifo Oseadeyo Ajimambedu II thanked the CEO for his well-meaning visit to the region and commended him for providing the NHIS offices in this region with the needed logistics for the smooth running of the scheme. He called on all Ghanaians to enroll onto the scheme for free access to healthcare.
Hospital akutua. Edia domafo be dey si benanim ne ananama hemfri dey. Onya dan an bejapade we nsabi. Sika bia ni ho a ye mu bi nkaye ntimi nyere. Yen ye kwa hospital ya. Yen ntimi mfantria. So ye nyina ye register bi. Asa ye ho kire ya. Ye form on na etimi ede boye bra. The mesre addition in Abawoka. Say, Obia wuni health insurance card. Tieni a bioka. Say, Sabiona there, no, near human could see. Baby. Oh, baby. Now say, I dare say, Yadiano, a fat. Now call hospital. Sabia Domain group. And now Sunyani, Kumasi, and then crime baby. Now Sabafabi, among Bradia. And they know my asset here. And they are not just a developed regional ministers. I call Dr. Okoboy, any honorable Koku Ajimambedu. What can I say?
Moving on, the Domahene of Goso traditional area, Nana Akisibo Sompra I, has stated that henceforth eligibility to summon at his palace will be solely based on having the NHIS card. The chief indicated that these measures are being put in place to ensure that his people prioritize their health and the need to have medical insurance, even as they spend considerable amounts of money to seek justice the customary way. He made the statement when the CEO of NHIA, Dr. Okoboy, paid homage to him during his tour of the Hafu region to commission 3 infrastructural projects.
Now, me introduce you. I want traditional council. So, we be a Oba Saman, Oba, This is what the health insurance ever. Because when you study about the mansion, now when you can't find your health insurance there, any number of mansion. The idea is introduced where so be our Baba Sama with the other. And I have a far point so at the one. I used to me cry over at the Mayan. Actually, the Abuama health insurance do be also traditional. Yet, me 1 year and a force. Oh, we are this year. Say you to me, Boissadian. So, who need to know I'm not a council and so health insurance?
The acting president of the Techiman Traditional Council, Nana Owusu-Jare II, has appealed to the CEO of the NHIA to include preventive health care in the NHIS benefit package. According to him, the inclusion of preventive health care will help Ghanaians to know their health status and curb the spread of certain diseases that will translate in the reduction of monies paid for existing curative services the scheme offers.
Yes, but now I am not between myself. They say they move a step forward, 1 step forward. Easy. The business of talk now insurance. Now we need Ampa, you have insurance. Our people are there that damn. Ampa, like I said, we have road wet. Ampa, the car not the contest. My room say, car no, the brake car, the light, BBR, the years and the rest of it. Easy. Answer now basic ones also. They said the amount a car no. Direction, road instructions, now follow, and so what to the car. I but otherwise, all insurance requirement is you soon answer. Cabin to go. But to their new say, they say preventive health care. In there, and can be registered as health insurance member. And your composer is they provide the service providers, hospital or person. Now, all your comprehensive checkup and you fully know the health status and doctor for me how to live. So, when children they are also, they say we notify the situation they go through. I feel we are deep in a year in Samia and this is hepatitis B, it could never be. And then other transmitted the year into the month about and she said, yeah, the health status. Nigeria crowd between the Assami, but of course, between the Assami. Until the teacher again, because we don't know our health status. But Ubeka will be people who are see are before. And so maybe not all your ambition. But it is not coming person. So, nobody registered here. They are encouraging now a fine check. Say, nobody check the status. But now, for how to live, you give you one. They are here waiting, they are standing over here. They are ready to see. They will not, they gather data. I'm not your health status, the whole country. But it is a more crack in Europe. How many people have hepatitis? Is it only people more HIV? People more weak. It's more clear.
The CEO of NHIA later called on the Bono East Regional Minister, Honorable Kwesi Edujan, at his office.
The vulnerable person is able to get operated upon, access medicines when they are unwell. Minister, we thank you too for all the support you have been giving our staff in the region, especially the director. It's our prayer that you continue to help them and the DCs and MCs too. I always advise my managers, if you get close to an MC or DC, it's your own interest. Life will be cool for you. If you stay far away, that's your business. We politicians, we are always roaming. If you don't get close to the center, Minister, you'll be lost. So I advise them to do the same. If you want something, you must go. You don't sit in your office and expect the MC or the MP to come and look for you. So I've been encouraging them to relate well. And whilst here, I make sure I pick all the challenges. So we'll go to Accra, we work hard on them. So I'm sure there might be a few issues, whatever the issues are. We are commissioning the regional office. I know some district offices also need some support, some even need new ones. But you can better tell your challenge than myself.
The regions, we have problems. And I will just speak to some of the issues that we have. But before that, let me commend you for the building which you've given to us. It's a gift from you. We also would want to thank you for the recent 5 vehicles which you've given to the Bono East region. We are happy. And, you know, we have 11 districts assembly, so feel with you that you increase it. We know it's hard, but I have a firm belief that you'll be able to help us achieve that. When it comes to the assemblies too, I think 4 of assemblies don't have centers at all. I think Crew West, Kranza North, Tichima North, and then Sene East. They do not have offices at all. On the part of Tichima North, I'm told that they've even rented a place for it. They have furniture. So what is left is a petition was left. So we can step back out of it. And the infrastructure needs, I think they might have indicated that two of the offices, two or three of the districts are rented offices.
Still in the Bono East region, the chief executive of the NHIA has handed 3 new NHIS branded vehicles to the Kintampo Municipal, Techiman Municipal, and the Bono East Regional Office when he toured the Bono East region. The vehicles are intended to support the district and the region's daily operations as they work hard to boost membership enrollment to attain universal health coverage by 2030. While in the Bono East region, the CEO and his team extended their visit to the Techiman, Banda, and Tyne district offices to touch base with the NHIS staff. To strengthen relations with staff, Dr. Okuboy, as part of his working visits to the Bono East and Ahafo regions, interfaced with drivers and district managers of the NHIS and treated them to a good meal. The staff expressed their gratitude to the CEO for his selfless leadership and visit to the regions. Staff of NHIS took turns to present challenges facing the scheme to the NHIS CEO and members of his team. The chief executive in turn praised the arduous work of all NHIS staff in charting Ghana's path to achieve universal health coverage by 2030. Now to some corporate registration exercise. The NHIA embarked on a 4-day corporate registration exercise for the management and staff of Intercity STC Coaches Limited. Staff from the various departments of STC, including the security, HR, parcel office, and drivers department, took turns to register, renew, and link their NHIS card to their Ghana card. Passengers and the general public were also educated about the scheme's benefit package, medicines list, the NHIS mobile renewal short code *929#, and the most recent My NHIS mobile app innovations. Now to our final story. Master Jonathan Quay, an employee of STC, told the NHIS team that his hectic work schedule prevented him from enrolling his son onto the scheme. But as soon as he learned about the corporate registration exercise, he immediately got his child to sign up.
NHIS no. Mianka Samaya Koda Hospital, Yusubi, Juma. Na Betty say by they say because from a small boy, but na baby man. She say Ibiana Ubibeka say be a Juma, but what the hospital Juma yipa metu a month for so be a nyebi. Ena nipa so e ba ha be NHS e wo say obi ade ne hoshim na ye ho Juma.
See, who say ye ba me fan say busy or ye we dream nti ye ba mo ha no aboa na
aboa me pa because me nya time en fa kwala na enkoye nti no me che say aba ha no na wo say me ba na mebɛyɛ ɛma akwara no nti no wohwɛ a mefi school ɛbaeɛ.
Okay. Na ono pe na waye bia na omba o maka mu.
Oh, bia obi.
Bia obi. Na
aka ono di.
Okay. Ene e da ma se pa se ne mo so. Otu kwa o mo makeka no. So be ka twom no mo ba.
E bo wa ma so bia e fa no hwishim. Okay.
Now, this is how we wrap up on this week's edition of NHIS in the Week. For more stories, do log on to our website, www.nhis.gov.gh, or follow us on all our social media platforms displayed on the screens. My name is Angela Siedu. Thanks for watching.